Evening, everybody. Thanks for chiming in. It's been kind of a zoo of 2 weeks here. Welcome to the new normal. So kudos to being a healthcare provider. It's not exactly what we signed up for. One thing I'm not going to do tonight, I want to use as much time as we can to go over kind of the lay of the land as far as dealing with the immune system. But I don't want to get into, all of the fiascos that are going on online about what's really going on. I'll let each and every one of you sift through that on your own. What I want to do tonight is kind of bring us all together as a tribe and help us realize what our role is in this. I've got to say that I'm a little disappointed with our state and national board associations. The chiropractic group has been behind the 8 ball. I noticed tonight they finally posted some information as far as what to do for your business, but nothing to do for your patients. And in our profession, patient safety is number one, as it should be. So we were let down by that. I work with Canadian doctors, and Canadian chiros were issued an all-stop on Monday. So I'm kind of basing a lot of my decisions based on what the rest of the world is doing, not what America is doing, but what the rest of the world is doing. I've got patients and other doctors on the ground in Italy, China, Japan, and South Korea. As you know, you've also got friends around the country. So we're getting a lot of good information as far as what's working, what's not. The big question we keep hearing, though, is this real? Is this actually happening? I'm not an epidemiologist. I'm not the one to tell you that. And frankly, who is? How do we know what numbers are correct? How do you believe the statistics coming out of China when we have video to show us the opposite? So tonight is all about how do we as practitioners better help our patients? Now, if you're in active and direct patient care, meaning you're hands-on in your office with patients, you have to realize that if you haven't taken the necessary safety precautions for the last 2 weeks in your office, you have to consider that you've been exposed, because we just don't know. And these aren't things that we normally do in chiropractic. We're not taking the temperature of everybody that walks in the door, but you do now. You don't have to completely scrub a treatment room after every patient visit, but you do now. You don't have to change your clothes after every patient visit, but you do now. So chiropractors, we've been forced into this medical world of almost sanitation. And thank goodness I've got a couple RNs that work with me, so they're up to speed on this. But you've really got to lock it down. You got to be careful. There's a lot of if, thens, and buts about this, but it's been pretty much laid out there for us that we are not essential. However, you guys are going to love this. The Canadian government has deemed that any healthcare profession that can help keep people out of the hospital is essential. So docs, if you're working on people and you're keeping them out of the hospital, keep doing that, please. You're doing a great job. But don't create unnecessary exposure. And for those of you out there that don't think this is a big deal, I want you to ask the families of the doctors and nurses that have died from this if it's a big deal. So things just got serious and real fast. Tonight, what I want to do is give you some content, and then we're going to come back and we'll have a little free for all tonight, see what's up. If your office is like my office, you just can't keep up. So I want to talk about how to take care of yourselves as well. Like Chris mentioned, stress is going to catch up with us. I was lucky enough to sneak in a massage this afternoon. That never happens on a Thursday. So use all of your tools at your disposal, even if it's a sauna, hot bath, whatever you got to stay cool and chill, because your patients are going to need to know what's up. There's also a lot of good webinars being put up right now from a variety of associations and groups on how to do a web consult. So if you're using nutrition in your practice and you want to talk to your patients, they can do a web consult. I have completely wiped my schedule for next week. And so I have loaded my book with web consults. And if you're not comfortable or familiar with how to do them, watch one of the webinars. It's easy to do if you have the tech. Just make sure you don't run out of internet bandwidth. Okay, so don't do them from your phone if you can avoid it. But as we go, we'll save some time in the end for questions, and we'll see what 30 to 45 minutes of content can do for you. And if I get a little too sarcastic, remember that sarcasm is an art. I am Canadian, so we tend to practice that. All right, so here we go. As usual, the disclaimer. Like I said, I'm not an epidemiologist. I'm going to tell you what I've seen in practice and what the epidemiologists have told me. I treat a lot of doctors. I talk to a lot of doctors from around the world. They're all telling me, take this seriously. It's a lot worse than anybody thought. I know the statistics don't show that. However, we need to go with what the rest of the world has seen. For example, Italy has been on the forefront for 4 weeks. So you all have your own stories and you talk to people. Just tuck that in the back of your hat for a minute as we go through some of this. I used a slide in Chicago on the weekend teaching my autoimmunity lecture, and I want to call your attention to Karen. So here's Karen. So Karen is code word for every expert under the sun that has no background. And we're all running into a whole bunch of Karens right now in all forms of media, not just social media. So I want you to just use Karen as a code word. Anytime somebody says, OMG, don't take elderberry. Hey, did you know echinacea could kill you? Wow. And you know what I'm talking about. What I found interesting is the apple cider vinegar people have been awfully quiet the last couple of weeks. So if you keep your ears to the internet, you find some very interesting information. I'm going to suggest you take a break on that. The state of Michigan has a good resource for finding out what's real and what's going to be affecting us. Like I said, the Michigan Association of Chiropractors has also posted good information on what to do if you're a business owner. And another quick one is just Google, click on Detroit, and they'll give you the most recent up-to-date what's what and what's happening. I do want to share some information from an old SP rep in Madison, Wisconsin, who has been notified that the western border of Wisconsin is now closed. Take that for what it is. But how are we supposed to trust our leading scientists if they're not getting accurate data? We can't trust our PhD students anymore because they've been sent home. And I had a conversation with a PhD student who's trapped in China, and she advised me to take this very seriously. So I'm going to listen to her. Who are our media experts? We're boots on the ground, people. We're the front lines. We're in the trenches. So be smart, and I'll keep dishing some tips as they come into my mind. Now, I've shown some of you this slide before, and this is Dr. Klinghardt of the Sophia Clinic and Klinghardt Academy, Autonomic Response Testing, ART. And if you do NRT, you've learned some of his technique. And we used to joke that Dr. Klinghardt was kind of, a little bit of an alarmist, but I don't know if he's joking anymore. It's kind of weird. So I threw that in there to help you realize that, a lot of us have been talking about an event like this for a long time. That event might be here. Last night, this took over the internet, and it's got a lot of hits on my Instagram page, and I love it. Because like I said, I know 3 docs that are no longer with us that died of this thing. Now, share this picture with your patients, because on my way home tonight, and remember this is day 4 of our quarantine, on my way home from the office tonight, driving up Sheldon Road into Northville, Michigan, I saw nothing but senior citizens walking up and down the activity path. And I thought, that's great, they're out and they're being active. Except they're the highest risk people. What are you doing out and about? Yes, you need exercise, but we're all doing our best so they don't get exposed. I'd love a little help from the people over 60 to maybe take this a little more seriously. And I've seen that with experience all week and listening to flight attendants and pilots talk about planes full of seniors being rescued from a cruise ship. They don't seem to take any of this seriously. So here are the rules. If you're over 60 or you're under 60 with a pre-existing medical condition, please hunker down. All right, the medical community is doing what it can to help everybody, but the worst thing you can do is flood the system. So let's just do the smart thing. All right, I know there's a lot at stake. I know there's a lot of wealth destruction, etc. But at the end of the day, if we all pull together as a team and a tribe, this is going to work. And then you open your mail today, and I notice I got a census. And I think it's very interesting that this census is so important that your response is required by law. Okay, so now we're all required to fill out the census right now, but we're not required to follow any guidelines that we've been given. So who knows what's what anymore? It's frustrating. I can tell you right now, I'm not sure if I'm supposed to fill this out as a Canadian. I don't want to get in trouble, but nobody really knows. So check your mail today. All right, here's our inventory list from Palmyra as a close of business today. Get some Andrographis while you can. Order it immediately. That's one tool that we all need to be using on a daily basis right now, and I'll explain why as we go through today. Don't worry about the large, just grab what you can in the small. The Astragalus complex, same gig, 200 smalls. We're going to need that complex for after this is over. All right. Echinacea, same idea. Now I know there's been chatter on the internet about don't use echinacea, it's going to kill you. The echinacea root is not going to overdrive inflammation in the body. The echinacea flowers will. So read the labels. You know the echinacea premium is root only. The flowering tops can be a little bit overstimulating and inflammatory. This is a great opportunity for you to explain to your patients you know your way around plant medicine and that the echinacea from MediHerb is the root only. Why would Ganoderma and shiitake be on this list? Well, these are your special mushrooms for immune support. These are going to fortify the immune system, particularly for those who are very run down. So my suggestion is if you've got any patients or you yourself has had to use a steroid in the last 4 weeks, you might want to add some Ganoderma and shiitake into your protocol. 2 a day. Also add 2 adrenal complex a day if you're not doing it already. So those of you on a steroid, and I don't mean just injectable, if you've taken an oral steroid or an inhalant, you need to keep your immune system topped up. Both forms of steroids are immunosuppressive. We've got lots of golden seal. Now's the time to snag it. We're going to need that later. Throat spray is great because it feels good. And frankly, right now, nobody wants to go to the doctor or the hospital. So make sure you've got a few of those in the office. Obviously, Pelmico is back ordered because that's frontline medicine in this situation. I'm pretty sure the Resco is gone because somebody has already ordered it after seeing this list. I know the Resco liquid is gone, but that's okay because as we go through tonight, you're going to understand that you also have the ingredients to make these. Okay, so if you keep a fully stocked inventory of nutritional support, if we run out of something, there's 3 other things that'll do the job. Okay, I got my berberine on today, so I was happy. So that's our MediHerb. Standard process. If you live in the Midwest, you know spring allergies are here, particularly mold. And this time of year in the Great Lakes, we typically get sinusitis or allergic rhinitis, and that inflammation drains into the lungs. People get a cough and bronchitis. Allerplex is a key lung remedy. If you've listened to me talk before, you know that's my go-to for people who have weak lungs with sinus allergies. Any questions about the cataplexes? Don't worry, because we've got those in a bunch of other products. However, there will probably be a run on Cataplex AC as our membrane support product because reports are coming out from the CDC that about 50% of COVID-19 patients suffer from GI issues. So let's keep those guts happy. Conjuplex. I've got some. Do you? I hope you do, because that's my frontline support for respiratory health. Conja for congestion. Yes, there's a few small left. Grab what you can. I have a strategic supply of Conjuplex next to the wine in my wine cellar. If you've never used Enfaplex before, obviously it's a lung remedy, helps dilate the lungs, promote circulation. Epimune and Imuplex, they'll come back someday. Old Dick Versandal trick with a hacking cough that won't go away. Make sure you layer in some pneumotrophin. Remember, that's going to help resolve inflammation in the lungs. And there's still some Thymax left, so don't miss out. Know what you have in stock. Make sure you grab what you can. And more importantly, get it into the hands of your patients so they can use it. What we're doing, if you don't have a web store, what you need to do to be completely compliant and safe, have your patients pull up to your office and have somebody from your office run their package out to them. Don't bring them in the office if you can avoid it. They can pay over the phone. The other thing you can do is just create a little bin like we've done and put their orders with their name on it. It's just like going to the Coney Island to get takeout, okay? People will appreciate it, particularly if you don't have to get them out of their car, it's even better. So some tricks to make people's lives a little easier. All right, so what are we going to do with this mess? Everybody's got ideas, everybody's got opinions. We need the 30,000 foot approach. We have to maximize our targets. So the main targets for viral exposure are going to be spleen, thymus, and liver. In this case, this particular virus, or as our president likes to call it, the Chinese virus, has an affinity for delicate tissue. And so it attacks your lungs with a cytokine storm. So our targets need to be the management of inflammation and the temperance of the immune system. We don't want anything to overreact. Now, if you've been around in practice 20 years or more, you probably remember SARS. And you probably remember reading that SARS would do things to histamine receptors. And so it would impact the healthiest people. That's not the case with this particular version of SARS. In fact, what we know right now is this version of SARS, the COVID-19, is about 1,000 times more irritating than the SARS we remember in 2009. So in my opinion, and this is echoed by a lot of other practitioners who are frontline, it's all about modifying as many lifestyle risk factors as possible. For example, first target, diet. For the love of God, if you want to do something for your body in this crisis, stop eating sugar. Sugar is going to delay and depress your body's response to this stuff. That's a simple lifestyle piece. The other component is hydrate. People die from pneumonia from dehydration and inflammation. Let's not let that happen. And then we know today that there is sufficient theoretical evidence, strictly underlined theoretical evidence, that people who are currently using ibuprofen and get infected have a poorer outcome. So the theory is that ibuprofen allows the virus to penetrate deeper and more inflammatory-wise. So that's good to know. And then somebody made a comment online about how elderberry will do the same thing as ibuprofen. And have you noticed during this crisis, all of a sudden, all these plant medicines and food medicines that we use that don't do anything, all of a sudden they do stuff. And all of a sudden we have all this science on them that says, oh, they're bad, don't do them. So that's great for us because we've been preaching this forever, that food is medicine and medicinal plants can help our bodies heal from a variety of issues. So that's good to know. I want to share one more tip. We haven't talked about this online yet, but this is theoretical as well. If you're on a beta blocker, the mechanism of that medication helps keep the heart rate down. And what the CDC is finding is people on beta blockers who get acute pneumonia have a more difficult time fighting back because their heart rate can't rise to the occasion. So if you have patients or you are on a beta blocker, I want you to take this particular crisis very seriously and do everything you can to support your heart. Obviously, that's going to be Cardio Plus. You might even want to look at Hawthorne, the tablets. So That being said, we've got some targets. Let's figure it out. We've got an inflammatory situation. Right away, throw a big gob of turmeric at it. So turmeric forte, a couple of days, going to go a long way. And we've got other tools for this. But since we're dealing with two parts here, we have a viral component, and then we have the rest of us that are not experiencing symptoms. So this whole story is not about, everybody that's infected. Well, what about us? What about the rest of us that are trying to keep everything together? That's the emotional distress. So if we're going to have a fighting chance here, I want everybody to remember you got to take care of you. You got to look at things like Nevaton or checks. You got to take time to breathe, go for a walk in the rain, work out, just don't go to the gym because you can't. Get a massage, get some acupuncture, get an adjustment, try to get some sleep. Do everything you can to stay in that woo-saw moment. This is a good time to start thinking about trying hemp oil products. Mix the hemp oil with some magnesium and some Nevaton. You're going to feel pretty slick after that. I talked to a physical therapist today, and she doesn't know what to do because she specializes in joint replacement patients. And what kind of mess are they looking at? How'd you like to have a recently done knee replacement and you can't go to PT for risk of infection? People are going to have to learn how to do stuff on their own. It's going to be exciting. Now, the modulation of toxicity. This is why people are dying of this. Their bodies can't eliminate the toxicity. One of the secrets to this is heavy dosing of vitamin C, keeping your vitamin D topped up. But one of the things you can also tell your patients is, and I'm sure you've been telling them all along, move your bowels. If you're constipated, the lungs are going to have a problem. In Chinese medicine, the lungs are married to the large intestine. So any lung issue can show up in the large intestine, and you don't want to weaken your lungs by having a wonky large intestine. So another piece of our protocol for a lot of our patients who eat a poor diet is to include 2 to 3 gut flora complexes a day. And one of the benefits there, obviously, is it's good for the tummy and it will reduce infection in the gut. But remember what gut flora complex is. This is Andrographis and it's oregano. And both of those are very useful in this situation. So we've got some targets. We're also going to talk about berberine and black cumin seed because I don't think those have been given mention to yet in this situation. So how do we get sick? How does infection happen? Well, stuff has to get in. And so I don't really want to make tonight all about COVID-19, but that seems to be what's on everybody's mind. So let's arm up for this. This particular virus likes to enter via respiratory droplets, has an affinity for sticky stuff. So the most vulnerable area of your body will be your eyes. You have a series of lymph nodes in your eyes called the conjunctival associated lymphoid tissue. And the very best plant for protecting your eyes is called eyebright. Duh. That's a hard one. Eyebright, what's it do? It's for the eyes. You'll find it in Sinus forte, which is not on back order. So most people over 60 have weak guts and a weird microbiome. And so their immune system is not easily responsive to the situation. So this is back to the microbiome discussion. Yeah, keep taking your probiotics. They work. Golden seal and berberine help keep that microbiome a little bit chipper. We know that diet and lifestyle set this up, and we know that people have a hard time getting rid of the toxins that they've created due to living our life. So some basic chemistry. 2 things I've been doing on everybody in the last 2 weeks. I call it shut the front door. You can laugh at that. All right, fix the hiatal hernia and fix the ileocecal valve. If you don't know how to do that, YouTube it. But the clinical pearl here is do it together. So reduce the hiatal hernia and the ileocecal valve at the same time. Neurologically, the vagus nerve will get a boost and they'll chill out for a bit. If you know how to do this, do it on yourself right now. Just find that stomach and find your ileocecal valve. Try and pull them together. Obviously, B vitamins play a role here. So with the hiatal hernia, if it's chronic, use your B vitamins and make sure you're getting plenty of digestive support. If the ileocecal valve is a little bit irritated or rebellious, don't forget Spanish black radish will shut that front door and promote a lot of that lymphatic drainage that we need in the gut. So that's been helping a lot of people. And what do you do after you shut the front door? You go wash your hands, because that's what we have to do today. All right, 5 levels of defense for the immune system. Fix the lining of the digestive tract. So we've got that covered. We've talked about how to do that. Secretory IgA or SIGA. See that big A? I want you to remember Astragalus. All right, tuck that in your back pocket. People with elevated levels of neurologic stress, like all of us right now, tend to weaken our immune system. So number 5 is the mechanism by which stress causes immune weakness. So don't forget to deal with the stress component. We've all put together our immune bundles for our patients. Starting Monday, we're releasing our stress management bundles, mainly because you've had to be at home with your family nonstop. And the kids are at home, and who knows what else is going on in your life. So busy time. Don't forget to try the hemp oil. If you've never used it, now's a good time to layer it in. All right, so Andrographis. Who's our friend here? We were all taught Andrographis is good for infections, take it short-term only. That's not true. Andrographis is protective. You can take it long-term in low doses. Protects your liver better than milk thistle. And it also promotes healthy bile flow. This is not the time to go heroic with Andrographis because we don't want to so-called stimulate the immune system too much. Now, I got into an argument with some researchers at another supplement company based out of Montana near Glacier National Park. You can figure that one out. They had a textbook that said that Andrographis was contraindicated in infections. And it was contraindicated in autoimmunity. And they said the same thing about echinacea. And so they put out a viral protocol to all of their accounts that said don't use echinacea or Andrographis for viral infections. Don't worry, I set them straight. Their textbook was not written by qualified scientists. The herbal safety textbook by Professor Carrie Bone set them straight. The content in the textbook that said not to do this was based on theoretical processes only. MediHerb dishes out the hard science. So the hard science of Andrographis, number 1, most bitter thing out there. You know what else is bitter? Chloroquinine phosphate. Boom, there it is. Our president today said chloroquinine phosphate is approved to treat this virus. Of course, the FDA freaked out and said, no, it's not. But that's what they've been using around the world, particularly in China. So for those of you that know what quinine is, if you've ever actually had straight quinine, it's one of the most bitter things you can ever taste. So this goes back to our bitter receptor discussion. As we run out of remedies, as inventories go critical, I need you to understand that if all you have is your spice rack, throw some bitters at it, okay? If you have a well-stocked bar at home and you can make a whiskey sour, then you've got bitters. So that might be something we can use as things run out. But the other reason I like Andrographis, you'll notice down here that it is protective. And one of the problems with this particular virus is it hits hard and fast, hence the acute part of SARS. So we know that quinine is effective against spirochetes like malaria. And we'll get into another herb that's good for that. But Andrographis is also very potent for any kind of acute type infection that's going to damage your joints, create a hepatitis situation, or even an encephalitis. So that's why Andrographis was at the top of my list when I first heard about this virus back in November. And I take Andrographis every day. The Andrographis complex is Andrographis, echinacea, and holy basil. And if you know anything about holy basil, it's nice and adaptogenic. It's also very protective of the lungs. I'm glad the dentists have chosen to close the doors for a bit. We don't need anybody opening up a dental infection at this point. And if you're a dentist, you know that if things go sideways, you need to send your patients to the hospital, the medical doctor, and now's not the time to do that. So one of the benefits of Andrographis is if you chew it and swish that tablet around in your mouth, and I know you're all gagging right now, but I do that every day because the andrographolides are so antiseptic that they will actually take out things like Mycoplasma salivarius, staph, strep, etc., sanitize the mouth, and also anesthetize some of the pain sensors in the mouth. So if you have sensitive teeth, go ahead and chew an Andrographis complex. See how your teeth feel after. It's a home run. I don't know why patients don't stockpile this stuff at home. I think this week we're over 100 units on the small bottle because that's all I could get. But this is one thing that you want to keep in your bug out bag. Now, as this winds down, let's talk about what to do after. As we've flattened the curve, where do we go from here? We're going to have a lot of patients who are freaked out, stressed out, worn out, and if they had this and did well with it and survived, let's hope they do, they're going to need to be rebuilt. This is where Astragalus comes in. Now, some of us might want to take some Astragalus complex right now because we're all pretty beat up. Okay, so if you've been tracking your heart rate variability and you notice that it's getting worse and worse and worse because you're stressed out, take some Astragalus complex or get some of the Astragalus liquid if it's available. It increases your IgA. We want that. Promotes health of the spleen. It'll protect the heart. I guess one of the other concerns that we've read about and heard about is the up and coming vaccine for this particular virus. And everybody knows that the way this is going about is not going to be good for anybody. So I don't know who's going to be first in line for that vaccine, but hopefully it's none of us, unless we're forced there. So, Chinese medicine tidbit. Astragalus helps the stomach spleen fortify and reserve energy. It also tonifies the lung qi. So if you've been working on patients that have been getting sick every 3 weeks this winter, you need to dose them hard and heavy on the Astragalus complex right now. 2 to 3 pills twice a day until they feel amazing. You could literally save somebody's life by doing that. So snap a picture of that slide right there because this is going to be a big deal come early summer. Now, I did listen to a press conference with Boris Johnson today, and he mentioned that they expect all of this to be over in Britain in 12 weeks, which I thought was pretty ambitious. So I would say load for bear for 12 weeks. Get ready to have everything we need. So I talked about dentists and their cavitated component here. That's why I don't think anybody should have dental work right now unless it's an emergency, and then you do everything you can to support that person. If you have to have dental work done because it's an emergency, and ask your patients, hey man, don't go to the dentist unless it's an emergency. If they have to go, they can chew the Andrographis, they can chew berberine, they can chew golden seal. All 3 of those will sanitize the oral cavity. Okay. I put this in here for us tonight because we've been talking about a particular virus, but so many people are so sick with all these other layers of immune burden. I don't know. I mean, if you start hammering a bunch of people that have never done natural medicine before, you're going to create a whole storm of events. So try to tread lightly, focus on the virus. Make sure you ask your patients, what else is going on here? Let's just not carpet bomb the system. Once this syndrome of crisis is over, go back with your patients and then talk about these issues. Because I think we've got the world's attention. Natural healthcare is front and center right now. We look pretty good in the moment. I'd like to keep it that way. So I mentioned quinine, chloroquinine phosphate. I was on the phone with a pharmacist today and we were talking about it, and he is ordering as many as they'll release to him. I can tell you the dosage that China is using is 400 milligrams twice a day of chloroquinine phosphate. That's what the Chinese are doing. That's what the Germans are reporting. We'll see how that goes. If all you have left in your dispensary is artemisinin complex, look what artemisinin can do. Because in Africa, they've been using artemisinin versus quinine for malaria. And we know that artemisinin does impact quite a bit of viral patterns. That being said, please do not dose this high. This is not a malaria situation. If you're concerned, if you've been exposed, but you don't know if you have it, you can recommend that you do 2 artemisinin twice a day for 2 weeks until this settles down, hopefully. But this is what artemisinin can do. So I like this because of its anti-inflammatory activation for the lungs. It's antiviral component over here. The other component way down here is anti-protozoa. What we're going to see is people are going to be so immunocompromised that other immune challenges are going to creep in. So powerful plant. We have lots of that. Get some, works great. And there's some good literature from MediHerb on how to use this stuff. I got you some microbiome information. So a different way to look at the microbiome. I got to tell you too that morbidly obese people, they are more prone to lung issues due to the inflammation caused by obesity. We have all these people that are forced to stay home right now. Now's the time to work on your weight loss program because you got all the time in the world. I know it sounds a little crazy, but if you're forced to be home and the kids are with you, why not all of a sudden take up the challenge and restore a healthy body composition? Because you'll help your lungs in the long run. So put that in there for you. That's cool. Some slides on vitamin D. Obviously, D is a big gig. Anybody with an autoimmune disease is going to be at risk for this. Vitamin D is key for lupus. Here's our lupus. I'm going to do a deep dive of all of these concepts for you in September here in Detroit, assuming we're allowed to have one. I've already had to cancel a bunch of seminars, so hopefully we'll be good to gather, and Chris will get you the dates on that. But we'll do a deep dive on autoimmunity for you. But vitamin D is the real deal. People who have a higher risk for vitamin D are over here, which is basically us. We live far away from the equator. We don't see the sun. Anybody that doesn't methylate well needs vitamin D. So right now, 5 to 10,000 units a day. Make sure you're eating some greens. And a little Cataplex F tablets can go a long way to help your body use vitamin D. All these kids are stuck at home. Now's a good time to bump up their D levels, and you might see massive improvements in behavior. So if you treat a lot of kids like I do, a lot of kids do not take their ADHD meds in the summertime. And so the parents have all wanted to experiment with this time off. Now's a good time to do that. Make sure they're getting lots of vitamin D. Another slide to link lymphoma with low D and Sjögren's syndrome. So D is real. Get up to date on that. And as things settle down, make sure you get everybody's vitamin D levels tested. All right. All right, we're going to close this up with some black cumin seed. Why the heck are we talking about black cumin seed during COVID-19? Well, if you run out of everything and all you've got left is black cumin seed, you're still in good shape. Because it's one of those when in doubt situations, use black cumin seed. Any histamine-driven mucous membrane dysfunction. Histamine is inflammatory. People are dying from this because their lungs become overinflamed and they basically drown. All right, nice. It also has a lot of good stuff for the gut. So when in doubt, black cumin seed. Most healthcare providers are beat and a little bit hopeless. Black cumin seed's a mood elevator. You only need 1 a day. It's a wonderful thing. Now, what about these people that are sick and recover? They will have experienced respiratory damage. Get on it. Black cumin seed, 1 a day. Literally, we're talking about saving people's lives. So I know this didn't get a lot of notification or notice, but you got to pay attention to black cumin seed. I know a lot of us, heaven forbid, if we were to cough in front of a patient right now, oh man, we are out. Most of us are coughing because it's allergy season all of a sudden. Use the black cumin seed during allergy season along with Sinus Forte and Allerplex. Remember, you only need one black cumin seed a day. Asthmatics are at risk for COVID-19. Here's another tool for you. The other thing you want to recommend with asthma is magnesium. It's a home run all the way. Lots of studies on it. You can look it up on your own time. People are sick, and we need a little help boosting their mood. Black cumin seed is a tonic. Okay, so anything that makes you feel better can go a long way. Works well with the curcuminoids from turmeric plus berberine. Schisandra fits in here nicely as well. If you're having a really hard day, you just don't think you can do this anymore, take a couple rhodiola schisandras and a black cumin seed, cup of tea, and let your cells do the work for you. The other thing I wanted to mention, I've talked about the berberine so far. It is antimicrobial. As the health of our population gets worse, you might want to have some berberine handy. This is a go-to for any natural antibiotic or antifungal situation. Also note, from a Chinese medicine point of view, while it is very bitter, it's also cooling. So if people's lungs are overheating, from a Chinese medicine point of view, you can cool them off with berberine. Again, it's a novel way to look at a, quote, novel virus. It's called novel because it's a WTF virus. The researchers are blown away by this thing. So, nice chart. I don't get to show this one too often, but this is the road to brain damage from COVID-19. So, I have your attention. We don't want Alzheimer's. I have a way to test you for Alzheimer's. You can check that out in the office. It's an in-office EEG. But your bronchial associated lymphoid tissue, when it's overactivated, just like in COVID-19, you will hyperactivate your microglia. Your microglia will turn your brain into oatmeal. So if you survive COVID-19, we're going to have to clean up your brain. So I'm sure we're going to have to set up a brain webinar in the near future once this dies down a bit, but nobody's talking about this. You guys are now briefed. My favorite bronchial associated lymphoid tissue product is Broncheffect. Obviously, that's what it's for. My favorite gut associated lymphoid tissue product from Standard Process is Ochrapepsin E3. So if you know anything about those products, you'll understand why they're so cool. The ochre is going to eat up the mucus, and the Broncheffect is going to strengthen the bolt. So nobody's talked about that. This is the connection between acute pneumonia and brain damage. This slide can help you understand why some people find that 5G might be related to this viral deadliness. So food for thought. Play around with that. All right. So if we're going to get through this as a tribe and a team, we want to understand that we're all under stress. We're dealing with it. Please try to eat well. I know we can't go out for lunch anymore, but you know, you need to eat. Now's a good time to try some of the meal replacements that are available, like SP Complete. Don't worry about heavy metals right now. Now's not the time to do a detox for heavy metals. Minimize your EMF exposure. Right? Good timing. Let's go sit on a webinar and talk about EMF while we're using all the bandwidth. And pretty soon my kids are going to start screaming, so ignore it because they've been off the internet for an hour, so we would have maximum bandwidth. So you can thank the Brockenshire kids. I put this in here because I want to make note of the class of 2020. I want you guys to think about this for a second. Everybody knows somebody who's going to graduate from something this year, and they all got the shaft. And so this is a shared trauma amongst the population. We're all going to be reading about this event in history books for years to come. So smiles abound. Try to make people smile, keep people chipper. Part of our job as a healthcare provider is to promote a little bit of hope. If we don't, the stress that we've experienced now and coming forward in the next few weeks is inheritable. So if you have any patients that are pregnant right now, I want you to reach out to them tomorrow or on the weekend and give them something hopeful. Give them a cool picture or a motivational poster. Don't use a cat poster. Those are so 1990. But do something to help people carrying children chill out. Because extreme stress in the third trimester will imprint on the child, and that baby will be born with adrenal exhaustion. And that's the last thing we need right now. We just welcomed twins into our office with my longest running CA. Two amazing kids. They look super healthy, and they're standard process children. They're big and they're beefy, and they were twins. Carried full-term natural birth. So there is hope. Everybody, try and get your patients to smile. Tell them something funny. Don't be so sarcastic like I am. All right, wrapping this up, and we'll get into some questions in a bit. Endocannabinoid system is what we need right now. You need a healthy endocannabinoid system. So use the hemp oil complex, get some ashwagandha liquid, use the rhodiola schizandra, use your turmeric. Talked about all this stuff, and we're going to deep dive in September on it. But we could all use a little bit of this right now. Now, personally, I've been mixing a couple kava tablets with a little bit of hemp oil and a big glass of hot water before bed. You sleep amazing. So don't forget, kava can help settle things down as well. See how many tools we have? So this is something my daughter painted recently since she's been home from school and she was bored. And I thought, wow, girl, you got a lot going on in that head. And she gave me this quote. So let everything happen to you, beauty and terror. Just keep going. Nothing is final. You got a bright future, guys. As long as we keep it together, it's going to rock and roll. So that's where we are. Hopefully I've given you enough information to breathe, and also a heads up on what to use where and when. You have good teams at your disposal, and you also have a variety of products that can be used in lieu of products being out of stock. If you get stuck and you don't know what to do, talk to your rep, or you can email me at this email. We are full on email crazy right now. So I will let you know that I just got a text and Lansing is in lockdown. So I can share that with you. Hooray. I was asked to pass that along from somebody working at the government building in Lansing. So if you're home, hopefully you're safe and you're doing something fun. That's my email. And you can roll